I would like to nominate our Emerge department. We are seeing higher volumes than our Emerge ever has, and despite the ongoing challenges of our healthcare system, the ED team works together to provide the best care possible for our patients. The positive morale of the department is not only seen within our organization, but also through the numerous kudos that we receive via online, in person, and via phone and email, thanking our Emerge department.
Patient care work done by these technologists isn't always as visible, but they play an important role in the healthcare journey of many of our patients, and I think it's important we acknowledge this. I've observed their eagerness to engage and participate in initiatives to improve care in our community. The goal is always very simple: to provide the best possible care for all. This team pulls together daily, going above and beyond to make sure that service disruptions are kept to a minimum while maintaining their commitment to provide the best imaging care possible.
BGH has never relied on our environmental services team so much as during the last 2.5 years. When we knew so little about COVID-19, how it was transmitted and how it would affect our population and how to destroy the virus, our EVS team donned PPE and defied the virus.
EVS is a tremendous asset within the emergency department. They are present 24/7 and they are quick to help when asked. Thank you for your ongoing commitment to BGH and to our community.
I'd like to nominate my team, the medical surgical team, for Team of the Year. They have shown courage, resiliency, they have shown commitment to our patients, and really are dedicated to providing the utmost patient care.
They demonstrate a lot of professionalism and compassion in our organization. They work everywhere in this organization, anywhere from Emerge to the ORs to med-surg, rehab.
There oftentimes I'm working with patients who need increased oxygen requirements, especially on exertion. It can be quite complicated. So I always have RT readily available.
We still have a need for respiratory therapy, especially for our patients who have ongoing respiratory needs. For example, I do have a patient up on our unit right now who is very complicated in terms of her breathing and needing supplemental oxygen, but also being very difficult to get a reading on. And it's so great to know that I can call the respiratory therapy team.
The respiratory therapy team here definitely gives us a breath of fresh air at Brockville General Hospital.
Behind these doors are 1,200 people that make this organization a great place to work.
At BGH, we kind of consider ourselves friends, families, and neighbors, caring for our friends, families, and neighbors. We're comprised of so many people. As Tiffany said, there's over 1,200 people. We have staff, physicians, volunteers, students, contract workers, and even family members who come in and support patient care.
It's been a rough couple years and everyone has come together, and we are extremely proud of our organization. So for this reason and many others, we choose the BGH team as the Team of the Year. You make us proud every day.
So from the very first time I met Gemma, I just knew there was something very special about her. The way that she interacts with the patients and the families is second to none. She's so kind. She treats all the patients just like she would treat any of her family members. And I certainly would want her looking after any of my loved ones if they were ever in the situation to be in the hospital. So.
I've worked with George for the last 4 years since he started at BGH, and he has been a very pleasant addition to our team. This is also a bittersweet nomination as he is retiring at the end of the year, and although we wish him well, we really wish he would stay. George is always pleasant, even when you give him some ridiculous demand. And although he politely tells you it's ridiculous, he does come back with something that is acceptable to both parties. He's an exceptional leader. He's really brought up the pharmacy team in the last few years, and it's been noticed.
Pam is a housekeeper. She works for environmental services and primarily on 2 East. So she's her primary responsibility is keeping the unit clean, the patient's rooms clean, the area safe, communicating with the team if there's any issues. She goes above and beyond to make, patients, visitors, staff, volunteers' lives a little brighter. I've noticed has gone out of her way on multiple occasions to grab a warm blanket for a patient if they say that they're cold, and she's in a room cleaning, chatting with them. I've seen her make them toast. I've seen Pam comfort patients when they're upset. I've seen Pam just put a hand on their shoulder and try to tell them everything will be all right.
Nominating Shawna because she's just made a massive impact in our community. We've seen a de-escalation on all calls. The fact that she's a nurse going in there with her experience, she's able to reroute a lot of people from just going to the hospital, which was the only avenue that police had before. Shawna has such empathy. I can't even imagine now going to a mental health call without having her there.
Shivali is a valued member of the BGH team. In her role, she's very well respected as a biomedical technologist, where she ensures medical devices are in exceptional working condition by providing preventative maintenance. In April, 6 hospitals across the southeastern Ontario, including BGH, sent extra medical supplies to healthcare teams in the Ukraine as they were under attack by Russia. Shivali took the time to reset all the clocks and the medical devices to the appropriate Ukrainian time zone. Her extra steps have shown the compassion and professionalism that BGH is known for.
It has been almost 2 years since Tina went from the resource team to being our one and only wound care nurse. She receives consult requests from every department for any patient with a wound, old or new. Tina then has to assess each case, and she develops a plan of care and communicates that with the healthcare team, teaching patients and nurses along the way. While Tina has exemplified BGH values throughout her career, she has really gone above and beyond since originating this role and proven herself indispensable.
Darryl doesn't simply exercise the hospital's values, he epitomizes them. Take accountability, for example. Sure, Darryl shows up to work 30 minutes early every day, but there's probably a few other candidates who do that as well. Darryl goes above and beyond to ensure that not only he is accountable for his work, but that the ACT team is accountable for the services we provide. One time it was discovered at 3:30 p.m. on a Friday afternoon that a client's visit was missed. No one had to ask Darryl. He immediately grabbed the phone and called the client to offer a support visit. Darryl corrected the team's mistake independently without mentioning it to anyone, without taking credit. If I was not his office mate, no one would know he had taken that visit. That every ACT team in Ontario would be lucky to have a Darryl, and their clients would be better for it. Darryl doesn't just share the workload, he takes on the extra stuff. He comes to the rescue of clients and he helps his coworkers. He not only respects our clients, but demands they be respected. He's never in a bad mood and he pushes us to work together as a team. Also, I should mention, he is going to be super embarrassed when he finds out we did this. On top of all these amazing traits, he's also humble and he minimizes his impact at every opportunity. Last week, he called himself lucky when he found housing for a client of ours who was facing homelessness. This client was not his prime client, and he was not in charge of looking for a place for them to live. But first thing in the morning, when he heard that they would be homeless that afternoon, he picked up the phone and called a bunch of places anyway before he began his regular day's work. And he found a place none of us had thought of. That's not luck. That's just Darryl.